Hey everybody, it's Dr. Nelson. We're talking about trigger points today, pain, especially in the muscles that's sharp shooting and can refer all over the place, and how we're so effective at treating it. So thanks for watching today. If you like this, hit the like button, smash the subscribe, you know what to do. All right, so we're looking at trigger points here. What are trigger points first off? They're a spot in the muscle that gets so tight, it cuts off its own blood flow. So imagine you have this spot in the muscle, right? And then you have the little blood vessels that go through there. And what happens with a trigger point is that it gets all tightened up, and then the blood flow can't get through there to release it, to take the trash out. There's a natural, normal waste production of cells, just the same way that you produce trash in the kitchen when you're cooking. That's the normal, natural way of just working, okay? So every kind of work produces some kind of waste product. It has to be able to be taken away. But if it gets so tight that it cuts off its own blood flow, it can't get there and can't take the trash out. So imagine how long it would take for your kitchen to stack up if every day someone only took out half the trash. It'd be fine for day one, it'd be okay for day two. Day three, it's gonna start overflowing pretty bad. All right, and then four, it's gonna get worse and worse and worse, and it's gonna get worse faster. Same's true of trigger points, and they will hide all sorts of places. One of the ones I wanna talk about with you today is in your trapezius muscle. That's this muscle right here on top of your shoulders. The ones that when people dig their thumbs in, it feels so good. Yeah, that's the one. All right, so it attaches actually from the top of your head all the way out to the outside of your shoulders. We're gonna say we're looking at somebody from the side here, and then it runs down, way down almost to your low back. So it's actually a huge muscle. But if you have trigger points right over here, they're notorious for this. They'll refer up to the back of your head, and then they'll refer up over your ear and then to the back of your eye like this, sometimes even into the spot in your jaw as well. Very painful. They can make you light sensitive, sound sensitive. They can give you horrible headaches just right here. There may or may not be pain lower down in your neck where the trigger point actually is, and they can refer up to 18 to 24 inches away from the actual spot. It could be all the way out here, and then if you follow the skin up over the ear to the back of the eye, it can cause pain right up there. So if you have headaches like that, or if you have muscle tension and then you have weird pains that people have tried to address but haven't been successful, that's a sign you might be dealing with some trigger points. Come and see us. We'll put you through a comprehensive consult and exam. We want to make sure we understand what you want out of care, and then what your body's actually dealing with, what that root problem is, and how we can address that for you. If you have other questions about other conditions we treat, make sure and watch the other videos. We're going to make a whole playlist out of this, so go ahead and check those out.